Dr. Crisp, critics might say you were caught napping. I mean, if some of these issues weren't flagged, might those regulations well have expired?
Morning, Mangani, and morning to the listeners. No, I don't think we had a danger of that happening. We've been busy for a long time now. As you're probably aware, there were over 300,000 comments that were registered with the department in the period of the 30 days. And so that we had to take a decision which ones could we continue with and should we continue with to make sure we stay safe at this time, and which ones need a lot longer and more permanent attention, because we are trying to deal with infectious diseases in their totality. COVID's not likely to be the last thing that we deal with. And there were some very substantive and useful comments that came in. So what was brought in last night is just 3 regulations which are under Section 90 of the Health Act, just to protect us during this period. As we know, we've got an upturn or a flicker of cases at the moment, and these 3 regulations can remain in place or may well be replaced at the end of the period of the longer review of the regulations in totality.
Let's talk about what they are. The masks, I'll start there. And there seems to be some confusion now. For example, the statement that accompanied the Gazette seemed to indicate that masks in schools will no longer be required. But if you look at the regulations that were gazetted, that doesn't seem to be there.
Yeah, no, that's been raised with me this morning as well. So the intention specifically is that there were lots of comments about schools, particularly basic education institutions in general, as opposed to other educational institutions. And the intention there is that we do not regard them as gatherings, and we regard them as a place of learning where we want the children to be as free and able to move as possible. But where it is, where there are sick people or people feel safer to wear a mask, that would be encouraged. But if they are just in the classroom and there's sufficient social distancing, then they will not need to wear a mask on school premises. But once you're out in the general public and you are moving into gatherings and in public spaces, then a wearing of a mask is a requirement.
And that's for indoors?
Yes, for indoors.
So just to be clear, you're saying then now, going forward, the wearing of masks for schools, for school children, is optional unless somebody's feeling unsafe or they're unwell. But generally, those are no longer considered gatherings but places of learning.
Yeah, generally we would still encourage everybody to wear a mask, but it's always been a challenge with small children, and even with some older children it has been a bit of a restriction, and so the wearing of masks is less of a concern to us in that particular environment, and we are dealing with a basic education environment differently. It's the close gatherings of large numbers of people where we're at risk. And I must emphasize that at the moment we don't really know what the virus is doing. It is behaving quite differently from what we've seen in any of the other 4 waves. So for now, and in this period, while we are busy with the 3-month period on the longer regulations, we do need to do everything we can as individuals, with or without laws, with or without regulations. We need to do what we can to stop transmission of the virus.
Part of the difficulties people are still having is, for example, you're clear in terms of not wearing masks outdoors, yet there's still a limit in terms of outdoor gatherings, either 50%, less than 50% of capacity, or no more than 2,000 people. If we're not wearing masks, why that restriction?
Yeah, so we've had lots of engagement with various people who arrange these outdoor gatherings. The challenge is not when you're sitting in a stadium and you're all spread out nicely in the stadium. The challenge is when people come to the communal areas, to pubs to buy their drinks or go to the toilets or go to the other communal spaces where people tend to gather much more closely with one another. And managing that within stadiums environment, we've had several discussions with stadium managers and with events managers and so forth over the past months. That's the concern, not when you're all spread out nicely in a park or whatever. So that's the reason for the limitation of the numbers.
But arguably, even with 2,000 people at an outdoor gathering, there might still be congestion in, let's say, the bathrooms as you describe.
Sure. So you can't you can't regulate for everything, and it's not our intention to try and put everybody into a specifically defined hole. That would be unreasonable, and that's not really the way in which we would like to see society evolving. We would like to see people take responsibility for themselves. That's why it's not an offense anymore to not do these things. These are they are regulations, but we would ask people to use. There's quite a lot of common sense involved when you know you are getting into an environment where it's potentially dangerous, where there's a lot of people at risk. For instance, a lot more old people around who get a bigger chance of a more severe infection and so forth. So using the regulations as the measure, and then using a lot of common sense around it to know how to behave in those circumstances.
And I think that's partly the concern so many people have, that all of this, and even going forward with the extension in terms of commentary on the draft proposals, is that ultimately this is just giving too much broader powers to government to deal with future outbreaks, when we as citizens have enough common sense generally to take care of ourselves and protect ourselves.
Well, history would tell us that that's not true. There's a wide spectrum of what people do. We have had traffic regulations since before I was born, and people still behave extremely badly in the traffic all day, every day. So we don't always have the kind of common sense to look after either ourselves or other people around us. And we do need to have some form of regulating to protect those of us who are trying to do the right thing when there are people who don't try and do the right thing. Unfortunately, that is the nature of society. But I agree with you that in principle, what we would prefer is to provide information as the health authorities and explain to people what is good for you and what is going to be harmful to your health, and then hope that the majority of people will certainly take that advice. We have advised people to vaccinate repeatedly. Every single time I've spoken to you and to anybody else, I've begged people to vaccinate, but we still have less than half of the adults in this population vaccinated. There are still people who don't even believe us that vaccination prevents severe illness. For young people, it prevents long COVID. It stops elderly people from getting severe infections and ending up in hospital. So we can do as much advice as we want, as much regulating as we want. People don't necessarily behave well.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.